So far, the topic of health has not appeared in the pre-electoral debate, despite civil society, patient advocacy groups, professionals, and numerous stakeholders engaged in the field have long been disseminating a series of manifestos focused on the future of European health agenda. This is another reason to encourage initiatives as the European Patients' Rights Day, promoted by Active Citizenship Network since 2007, that give the opportunity to analyze and discuss on citizens' expectations and stimulate a debate between those who care about health as a common good and those who will be called upon, if elected, to take decisions for millions of Europeans.
Today we are here for the European Patients' Day, that is now a recurrent, very important event about the rights of patients across Europe. We have new challenges that we need to tackle in these future years, from antimicrobial resistance to vaccine hesitancy to new technologies that must be adapted to be effective for new forms of telemedicine, and many, many more challenges regarding access to medicines, access to quality treatments. 69% of Europeans want more to be done at EU level for healthcare, and we need to deliver on that request coming from the citizens. Today we are discussing this, and we are trying to build an agenda also for the next years.
The European Commission and XIII will continue our efforts to make health of European citizens closer to their hearts. So we continue to build our agenda around legislation, which is a number of important fields like medicines, like tobacco, medical devices. This is an area where we have to continue make legislation and products especially available to the patients in the European single market. We will continue our financial efforts through different programs like research program or ESF Plus program, which is replacing current health program, or we will continue support of member states through the structure funds allocated to health areas. And finally, there will be a number of policies to be developed and continue to develop. Vaccination is an area which already is a huge commitment from member states and Commission, Parliament to work together. The areas of antimicrobial resistance, which agenda is still ahead of us, and we continue our effort both sector, human and animal. And finally, there are issues like obesity or other factors, which make people's life shorter and more difficult.
It's very important that patients are engaged everywhere. Like I already told in the meeting, patients and caregivers are two different people. And once you are on the side of the patients, you see the world on another side. So it's very important that they can say what is necessary for them.
I think one of the key priorities is that we really start to measure what's important for patients, and that's the health outcomes that matter to patients. And here the EU can do a lot in help the member states to standardize how we measure health outcomes throughout disease areas, and you need to go patient group by patient group, and then help the member states implement the data collection systems necessary, because then we can really start comparing what kind of outcomes that are delivered for patients in different countries, within countries, compare providers, and that will really be a step change forward for patient-centered healthcare in Europe.
I would say work with them together, because they can't tell us at once what they want. We can't say at once what is important, say we as experts. And the politicians can't decide once for all how to do things.
I will give you two words. It's removing borders. I think it's ridiculous that in the 21st century in the European Union, your access to healthcare is still, for a great deal, depending on what country in the EU you work. Even in border regions like my own, where between neighbouring countries there are huge differences, and whether you live on one side of the border or the other has a huge effect on your access to healthcare, to medicines and to innovative treatments. So that is what I would like to do in the next 5 years, make sure that the cross-border cooperation, the cross-border possibilities are furthered.
After the European elections, Active Citizenship Network will continue to advocate on and influence health political priorities and to increase cooperation among European institutions, relevant stakeholders, citizens and patients organizations. for this reason. Firstly, we encourage the new European Parliament to provide continuity to the MAPS interest group focused on patient rights, following the successful initiative launched in 2015 by Active Citizenship Network with the endorsement of almost 100 associations. Secondly, we will send to the new MAPS and the new European Commission a position paper focused on citizen expectation debated during the last European Patient Right Day. It means the patient right to access health innovative solutions and the patient right to preventive measures, including vaccination and screening.